And so in the end, we will ask, why is it so difficult to treat the cancer? Because cancer cells are also part of our cells. So just distinguishing cancer cell from normal cell can be very challenging. So to taking advantages of those differences between cancer cells and normal cells, we know some genetic differences, and maybe some differences are more specific to the subtype of the cancer, even to individual person. So for example, genetic is like a rapidly growing growth is a genetic feature of the cancer. The problem is some of the normal cell types are also growing and proliferating. That gives a side effect of chemotherapy. While, for example, let's say there's a breast cancer, if we know more detailed of subtype, such as HER2, human epidermal growth factor receptor 2 positive breast cancer, which was actually giving a poor prognosis in the past. Now, after all, we give a treatment which is specific to HER2 receptor, which may even effective for those subset of HER2 positive breast cancer patients, that they can even live longer with this targeted therapy drug. So genetic treatment is, we know cancer starts from one cell in one place, and that will grow as a tumor. Then we can use surgery. But it's better, as we saw from before, the prognosis and staging, early detection methods. So where we can find out this cancerous growth early enough stage, the 5-year survival rate can be very high. While we know that cancer cells divide faster than normal cells, using that characteristic, we use a radiation to disrupt the DNA so that the killing those rapidly growing cells and chemotherapy. But these are more generic treatments. The future treatment will involve less side effects and more specific, which is already done these days. Hormonal responsiveness, some specific type of prostate cancer and breast cancer, if the cancer cells are, growth is dependent on specific type of hormone, then we can block the action of the hormone effect on the cancer to modulate the cancer growth. And some other specific type of cancer is thyroid cancer, which is coming from the thyroid. And in this case, we can use the thyroid usually uptake iodine specifically, and iodine is not goes to the other. So we can come up with iodine with a radioactive element. Then that injection of iodine intake will accumulate in the thyroid, and that gives a radiation, local radiation therapy itself. So that can be a specific treatment. And of course, if we find the type of cancer cells and the specific growth factor receptor, then we can target those receptors with a very specific monoclonal antibody. The problem is these drugs will be very expensive, but very specific. So supposedly involving less toxic side effects.